Gentlemen. I can handle it from here, thank you. Mr. Walker, Dr. Oliver Thredson. Diagnosis, acute clinical insanity.
You've seen our killer of women, I trust? So what's it gonna be? We're gonna spare the taxpayers the expense of a trial, or will I have a bed opening up?
I haven't made a determination yet. Might we speak privately about the conditions here? In just the short time that I've been here, I have witnessed appalling things. Malpractice? Candidly, I'm shocked.
It's a madhouse, Doctor. What did you expect?
I expected some form of treatment, therapy. Sister, your hospital still administers electroshock therapy to treat homosexuality. It's barbaric. Behavior modification is the current standard.
Tomato, tomato. You know, Dr. Thredson, let me remind you, your job here is to write a recommendation to the court regarding the sanity of one patient. So I suggest you do your job and let me do mine.
I'm sorry. I didn't mean to interrupt. We haven't finished our conversation, Sister Jude. I didn't realize you had company. I'm Dr. Thredson, psychiatrist here. I'm at your service.
You need to leave, Doctor.
Sister Jude, please. Boy is troubled. We could use a doctor's opinion.
How can I help? Adolescence can be a time of conflict and rebellion.
No, Doctor. Jed sees things. He hears voices that aren't there.
I'm afraid he'll bring us harm.
Nothing? For a man whose profession relies on talk, 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 you appear to be at a loss for words, Doctor.
I would need to see him in order to provide an accurate diagnosis.
We're proud of you.
Let's go see the boy now. Dr. Thredson, you are but a guest in our institution. Don't wear out your welcome the first day.
In my estimation, the county hospital might be better equipped to treat your son. Mr. and Mrs. Potter, are you aware what kind of specialist is on his way here?
Monsignor explained the situation.
Monsignor.
This must be...
The tiresome Dr. Thredson.
Dr. Thredson. Sister Jude was just sharing with me your concern.
It is 1964, for God's sake, an exorcism. You can't be serious.
Times may have changed, Doctor, but the nature of evil has not.
You expect me to stand by as some witch doctor comes in here?
Stand by. On the contrary, Doctor, what I expect is for you to assist.
I beg your pardon?
You may view us as backward and barbaric, but the church requires a licensed physician to be present at all exorcisms. As a psychiatrist, you're also a medical doctor.
But you're mistaken if you think that by making me an accomplice to this, I won't report what I've seen here. Heart increasing, blood pressure rising.
Oliver, look at you. I see what you've become, and I'm glad I gave you up.
He's in cardiac arrest. Unless may the Lord who frees you from sin save you and raise you up.
He's dead. Everything all right, sister?
Inclement weather always upsets the natives, their fragile souls.
That's why you should stop using corporal punishment. At our meeting yesterday, Mr. Walker couldn't even sit down. I realize you're likely unfamiliar with the work of B.F. Skinner, but positive reinforcement is proven to be far more effective. In lay terms, sister, a little compassion would go a long way.
Me? I'm a beacon of compassion. I thought a movie could distract our charges when the storm hits.
I wouldn't have figured you for a movie buff. I'm impressed. And if I can help in any way, please don't hesitate to ask. Oh, yes. As attending physician of Jed Potter, I'll need his autopsy report for my files. I'll bet it says he died of natural causes.
If it's natural for a 17-year-old boy to die of a heart attack.
You have quite a suspicious mind, sister, bordering on delusional. Or maybe it's just a form of projection. A defense to protect your own guilty conscience.
That office we gave you, I need it back. You've had more than enough time to advise the courts. You've got 2 weeks, and you're out.
He had lunch in his office. Tuna fish sandwich, right away. some oatmeal cookies. Then he made a phone call to the doctor's office about removing
Was
a
anything
mole.
suspicious, Frank?
Nothing, sister. Dr. Thredson seems like he's on the up and up.
Well, I'll determine that. Keep watching, Frank. Assume the worst.
Roger that, sister.
Dr. Thredson, my name is Lana Winters. Can I have a word with you? In private?
Miss Winters, I know a little about your case, but I'm not authorized to discuss your treatment.
Dr. Thredson, you are my last hope. Will you help me give her this message?
You're asking me to betray Sister Jude, who is the administrator of this sanitarium.
Starring Miss Claudette Colbert as the Empress Popia.
It'll never work.
But she was alone.
What the hell was that all about?
Well, she's bats, right? Hadn't you noticed?
Miss Winters, I know how alarming this is, but I'm afraid something might have happened to your friend. There were certain similarities between Miss Piser's disappearance and some of the other victims.
Other victims? What are you saying?
Yes, Divine Caesar. These rumors.
That I have some concerns which have related to the police, but unfortunately, they're so invested in the idea that they've already caught their maniac that they won't even entertain the idea. And maybe they haven't.
But they have caught him, haven't they?
To be honest, I'm not so sure anymore.
It's really not appropriate for me to be seeing this, considering my condition. Sister Jude will understand. I'm going to the ladies.
You're a butterfly with the sting of a wasp. Singing! There is no death. Only a crossing over to the Father.
Excuse me.
What? There appear to be some patients missing. Have you been aware of that?
I believe I can help you. I'd like to try if you'll let me. I see myself in you. You're a fish out of water, Lana, gasping for life. It won't end well. Trust me. The problem is I don't think you're crazy. But I don't think you're evil. You killed the thing you loved the most. I'm leaving here on Friday, and I am taking you with me. I don't know how yet, but I will not leave you in this place, Lana. That's a promise. Sounds to me like a classic case of postpartum psychosis.
How long have you been standing there, Dr. Butinsky?
Long enough to make a pretty good diagnosis. The obsession, the manic behavior, the disconnection from her baby.
My wife isn't a psychotic. She needs to come home.
I think that's dangerous. You're making a mistake.
Forget about it, Doctor. None of our concern anymore.
Kit Walker is my concern. What's this barbaric rumor I hear about sterilization?
It's not a rumor.
You're not a doctor. You have no right to authorize medical procedures without their consent.
We're leaving right after dinner. Meet me by the front staircase at 6 o'clock.
Is this real?
Don't be late. You need to give yourself permission to remember. I think one way to do that is to hear it in your own words. I want you to describe what you think happened. Then I'll play it back for you so you can hear it in your own voice with your own ears.
And if I do that, you're gonna tell the courts that I should stay here and that I don't go to the chair.
Yes. That is the bargain. But I need to feel you're sincere. Are you ready?
What's the plan? How do we do this?
We walk out the door. We walk straight to my car. Do you understand?
What do you mean? How do we get past the guard?
Like I said, walk.
Dr. Thredson! Dr. Thredson's Sister Jude is asking for you.
I don't work here anymore, Frank. As a matter of fact, I never did. You can tell her I said that.
Dr. Thredson,
Oliver.
I really appreciate everything you've done, but I think I want to go to my house.
Lana, once they discover you missing, the first place they'll look is there. You're much safer here, at least for the night. Relax. That place is behind you. Please, come in, have a seat. You're gonna write about this. You're gonna win a Pulitzer Prize. I just know it, Lana. You're the person to tell my story.
Your story?
Mint?
Would you mind if I used your restroom?
Sure. It's right down the hall. I see you found my little hobby.
You make furniture?
Lamps, mainly. I make the shades myself.
Really? What kind of material do you use?
Skin. Normally, by now, I would have removed the skin. And head. But we need to keep her around a little longer for our purposes. We're gonna continue our therapy now, Lana. Don't worry. She won't bite. I took her